Good morning, travelers, pre-med students, and undergraduates. Welcome to Doctor's Inn. This is where medical experiences are shared, study strategies are examined, and life lessons with a sprinkle of advice and habits are served. Yeah, and especially with research is evolving. Speaking of research, you have been very successful, as I said in the introduction, with your research presentations with papers, often winning, awards for your research. So we can kind of segue into pre-med advice. So how can a pre-med or a medical student become recognized for their research? Because, let's face it, like nowadays, every doctor in training is required to do research. So do you have any advice in regards to this?
Yeah, 100%. I always tell, so what I did was I went to Ross, which is a Caribbean school, and I knew I wanted to match into a very competitive fellowship. And right away, everyone's like, oh, you can't do that. That's not going to happen. And I was like, well, of course it's going to happen. Anyone can do what they want to do. And I was researching into into the field I wanted to match in. So know what you want. You don't have to be, but if you know you want to kind of do plastic surgery, then there's a million ways to get about it. So I know for any field, like you said, research is very important. So align yourself with somebody who's very prolific. So I found a big genetic center in Chicago, and I was like, hey, I know you guys do a lot of cool cases like HLA matching, like save your siblings and IVF to create these babies. Like, I want in, how can I help you? And they're like, oh, come data mine. And I was like, sure, I'll come data mine. And I started data mining from them. Then I became their research coordinator. And this was done in between my classes. And I continued to work on nights or like when I went to Ross, you would get these 2 breaks in between. They're called post trimester breaks. And then I would do 2 weeks there, and then I'd work on papers and send them abstracts. And so it just became a really good relationship. And I did that all the way. So that helped me match. I presented at a national conference as a prize paper as a medical student. I got a very competitive residency and got a very competitive fellowship, but I never broke those ties. Those were the ties that kind of took me all the way to where I am today. So find what makes you happy. And you don't have to know. My little brother's applying now, and he likes everything. So he aligned himself with different areas. So he likes cardiology, he likes GI. So he did just do research, just set your application apart.
From your answer, there's 2 things that I'm hearing. The first being you have to be proactive with your research, not just doing passive research, but actively looking into it. And the second thing is developing that connection with your PI, with other lab personnel.
Correct. Yeah. And I think also as a pre-med, it gets disappointing because you do a lot of work, right? And then you don't get your name where it should be. And you're not, you don't get to make a lot of the decisions. And you may know a lot more of this than most people on that paper do, but it's okay. You will get there. And I think that was really hard for me to understand. I didn't really have anybody in my family to kind of ask, what should I do this? So I was constantly am I getting bullied? Am I getting used? But you will get your spot. And ask them, hey, I'm doing this work. Can I, set expectations early on? What can I expect? Am I going to be on the paper? Am I going to be on the abstract? So at least it's not disappointing and they know what you want from it, right? Because of course you want something out of it.
Perfectly said. Just setting a goal, talking about it, being very transparent with what you want, what they are willing to offer.